Welcome to The Topic, where we highlight Houston Community College, our students, our programs, and our reach into the community. I'm Todd Duplantis. We're live every Tuesday afternoon at 1 p.m. on Facebook and YouTube. You can subscribe to our YouTube channel and follow us on social media as Houston Community College District. Later in the show, I'll tell you how you can download all of our shows as audio podcasts. You know, in our busy lives, we often want to stop and just take a deep breath. Well, for some people with certain conditions, that's not an easy task. This is where respiratory therapists come into play. Teddy Tovar joins us now to talk about HCC's Coleman College for Health Sciences Respiratory Therapy Program. Good afternoon, Teddy. Thanks for being here on the show.
Good afternoon, Todd. Thank you for inviting me back. I really appreciate your team. You guys do a wonderful job of informing everyone.
Well, thank you. That's what we're here for today, to talk about what exactly. Now, it seems like since COVID, respiratory therapists, especially when I've talked to Coleman College, Dr. Nicoteri, yourself, talked about the importance of respiratory therapists in the wake of COVID. Is that still the case?
Unfortunately, it is, Todd. COVID's not quite gone in its entirety. There are still some reported cases in different states. But more importantly, the after effects of COVID, as the news media made it aware to all of us, and physicians made it aware to us, that it affected everyone differently, and it also because it affected everyone differently, there's a lot of patients that are still having after effects of long-term COVID issues.
And what exactly does the respiratory therapist do, and how can they help these victims and others?
Well, the beauty about respiratory is that not only are we accessible in the hospitals, but we're also now being seen in the clinics, and now we're very active in what we call pulmonary rehabilitation, and that is actually what it means: pulmonary rehabilitation, rehab, trying to teach our patients how to get back to what we call unquote unquote normal living conditions. Trying to teach them how to do breathing exercises to help them cope better with daily living activities.
For many of these patients, are they able to regain back to maybe 90 or 100% of where they were before whatever incident happened in their lives? Are they able to do that?
Statistically, and from research that we've read, because we have to keep up with scholarly readings and stuff, we have found out that some patients have been able to reach back to at least 90-95% of their normal routine. Unfortunately, we don't believe that anyone does ever get back to 100%. And again, it all depends on each patient, as every individual is completely different, regardless that it's still COVID virus. Everyone reacts differently. And that was one thing that we learned during this pandemic, is that it didn't matter who it was. Everyone was literally treated individually. It was almost a tailored treatment methodology approach.
So it sounds like there's no ballpark of this is how long it takes the patient to get better. It's different for each and every one. And the respiratory therapist has to work with the doctors to execute a certain plan tailored for each patient. Is that correct?
That is correct, Todd. Respiratory therapists play an intricate part in the healthcare team. For many years, there's always been a healthcare team to sort of drive and develop care plans for patients. But now, in this day and age, with respiratory therapists being so specialized, not only in disease process technology, we play a very intricate role in that process of care plan, not only within the hospital, but also as case managers for those patients that are going to be released from the hospital and receive home care at home. And that's another area a respiratory therapist plays a key role, is within the home care arena.
And what does HCC offer as far as credentials to get our students trained to be a therapist?
Well, the respiratory therapists here at Coleman College at the campus, first of all, out of all the sister campuses, Coleman College is the only one that offers a respiratory therapy. We're centered in the medical center, Texas Medical Center. We're the only community college there. We're housed with Allied Health, and the respiratory therapy program is a 2-year program. six semesters. It starts in the fall and ends in the summer. Again, it's 2 years. You receive an associate's degree in applied sciences and respiratory care. But in addition, we've tailored our program to allow the student to gain two additional credentials, if you will, or certifications, which is advanced cardiac life support and neonatal pediatric provider. So those are two additional credentials that we, as of now, we don't think that any other program offers that.
What is the demand for these workers? Obviously, we learned about them during the COVID time period. Obviously, some demand is going up. We've got an aging population. You hear about it every day. People are quitting smoking. Now they're developing COPD. So demand obviously is going up for these workers. What can our students expect as far as a pay range once they get finished with the program?
Currently, we looked up the mean pay range, annual salary anywhere from $76,000 to $80,000 a year.
Wow, with a 2-year training program.
Oh, yes. And as far as job placement, just to give you an idea, we graduated a group of 13 on July 30th. July 28th. And out of the 13, 10 already had positions. They've been working while they were in school. So the demand is there. Statistically, the labor market is looking at a 13.8% in job openings between now and 2025.
And it sounds like, and that was going to be my next question, I know Coleman's very good about getting our students working before completing their program, and it sounds like that's the case with this program as well.
That is correct. We're very fortunate. We're very deep-rooted in the medical center. I think that one of the strongest things about our program is that we have very strong relationships with our clinical partners, and they see firsthand that our students and our graduates, and they see that we produce a competent respiratory therapist that is conscious and has ethical practice theory.
And Coleman's won some awards with this program. Why was that?
That is correct. Our accrediting agency, which is COARC, or the Commission on Accreditation, recognizes those programs nationwide that their students have achieved one of the highest credentials within 3 years consecutively. The program received its 10th consecutive award this past year. So we're very proud of that. I think that really details more than anything the commitment our faculty have to our students and the investment we have to make sure that we have good, competent respiratory therapists once completing the program.
I know Coleman enrolls students differently than the district does across the HCC system, and I imagine this program is the same. When can students enroll? Is it too late to enroll for the fall? What are the details there?
You know, Todd, that's a great question, and thank you for bringing that up. Unfortunately, it is a little too late. We've already accepted our students. Just to give an idea, and yes, you are correct, we are a selective program. A selective admissions program, which means that before a student comes to us, they have to have completed certain prerequisite coursework along with immunizations and so forth. But just to give you an idea, we do receive about anywhere from 50 to 75 applicants, and we are only allowed to accept 25 by our accrediting agency. And so we've already selected our 25 for this fall. And again, we only admit in the fall semester. So those students that are currently interested would have to wait until fall of 24 for admission. But I think that allows our students students time to take care of those prerequisite coursework and immunizations that are required.
So now's the time to start thinking about fall 2024 enrollment. Teddy Tovar with the Respiratory Therapy Program at HCC Coleman College. Thanks for being here.
Again, thank you, Todd, for having me. You guys do a wonderful job.
Thank you. All right, we're going to take a quick break. When we return, we'll talk more about the Respiratory Therapy Program. The topic will be back in 60 seconds.
Sometimes what you need just shows up. Houston Community College has your back, whether you're knocking out some basics or upping your game for a better job. Enroll today for spring classes and frame your future with HCC.
For more than a year, we have kept you informed with more than 500 remote episodes. But now we're back, bigger and better with more news and more guests. Join us live every weekday at 10 a.m. on Facebook and YouTube, and on HCC TV at noon and 5 p.m. You can watch from anywhere. We go where you go. Welcome back to The Topic. I'm Todd Duplantis, and we're live every Tuesday afternoon, 1 p.m. on Facebook and YouTube. Subscribe to our YouTube channel and follow us in social media as Houston Community College District. Later in the show, I'll tell you how you can download this show and all of our shows as audio podcasts. We're talking about Coleman College's award-winning respiratory therapy program this afternoon. Instructor James Campbell is with us. James, thanks for being here this afternoon.
Thank you, Todd. Thank you, and to your team as well for having us.
Absolutely. We were talking earlier about the duties of a respiratory therapist, and really the importance now. But what do you think attracts people to this profession, and what's rewarding about it?
All right. Well, the pandemic is probably our biggest promoter about our profession. It actually brought us to the national recognition of the importance of respiratory care and what we do as far as treating patients with cardiopulmonary diseases. So with this increased awareness, there was actually now an avenue that individuals are realizing that they can actually have a rewarding career in a medical profession with higher salaries, flexible work hours. They work in different environments. They interact with different people, diversity. It's a lot of people from different backgrounds, their patients, their family members, and becoming part of the healthcare team. And they provide cares in different areas like the adult, pediatric, neonatal, from floor therapy, pulmonary functions, emergency department, ICUs. Even part of the transport team on ambulances, fixed-wing aircraft or planes, and even helicopters. So it's a very dynamic field. It provides the RD practitioners several avenues for career advancements as well as degree advancements. And it's very in high demand right now. I mean, the U.S. Bureau of Labor Statistics, again, was mentioned earlier, about a 14% growth, and that's all the way to actually 2031. And there's an annual average openings of about 9,400 per year. So upon completion of the program, the individual will, pass the national board exams, acquire a state license, and then now it's not simply just getting a job, but rather it's a rewarding and lifelong career in short 2 years time in the workforce in this program. So it actually has the opportunity, the individual, to advance their social economical status while providing quality care for the patients as well as improving the health of the community.
You mentioned earlier that the students take a national board exam. Does that mean they can get their certifications here in Houston and choose if they want to stay in Houston or maybe if they want to move somewhere else around the country? Is that are they able to do that?
That's correct. Yes. So with the national board exam, it's the whole nation of the U.S. So after they pass it, they can actually move to a different state. And now when they go to that state that's out of Texas, they want to go Florida, they want to go California, New York. Then each of those states have their own requirements of how to acquire their licensure in order to practice in that state.
Okay. Describe how the program works. What can students expect as far as classes and lab work?
Okay. It's actually a progressive pathway as a student is completing the program's curriculum. So they start with the foundational courses in the first 2 semesters, followed by the intermediate, and then ending with the advanced courses for graduation. So the lab actually includes the Coleman Simulations Lab as well as the classroom lab. So that reinforces the classroom content and it aligns with the competencies for that respective semester. So for example, during the first semester at the hospital, the student will complete hands-on competencies, respiratory procedures that are currently taught in the classroom and practice in that lab. So again, like for example, is like the first semester is adult floor therapy. And then the next semester is adult ICU. and then pediatrics, pediatric floors, pediatric ICU, and then neonatal or premature babies in ICU. And then so you can see there's a progressive manner. The beauty of the program is the experiential learning experience by each student during a clinical setting. And this happens at the various hospital organizations here in the Houston area, including the world-renowned Texas Medical Center. So every semester, these clinical rotations that are directly supervised by a professor provides that student the opportunity to apply that new knowledge learned from the classroom and the lab in a medical environment on real patients. So each student learns and masters the classroom content with positive reinforcement during the clinical rotations as they apply it. And so they develop their critical thinking skills, they network, improve communication skills. So in essence, it's kind of similar to building a house. You know, you start with the foundation and then the frame and then the roof. So everything is all connected at the end.
And it sounded like from what Teddy was telling me, students can start working in environments where they're going to eventually get paid, or do they get paid as internships during these clinicals? How does that work?
Actually, there is during the program, because of the pandemic and the shortage right now, they actually do have respiratory student positions at the various hospitals. And so that allows them to, practice and again, honing their skills at the bedside while getting paid. Now, this has to be separate outside of the classroom and the clinical setting.
Okay. And how does HCC, particularly Coleman, prepare your students to face the board exams? That sounds like that would be a lot of incredible pressure on someone, because I imagine you only get one shot. Is it a time limit? If you don't get the first shot, you get to take it again right away, or how does that work?
Yes, there are multiple attempts allowed.
Okay.
But we try to avoid it at all possible. So yes, in preparation for the boards, what the program does, because the boards consist of two major parts. There's the multiple choice section and the clinical simulations. And that's all those different diseases, the cardiopulmonary diseases like COPD, asthma, even drowning, motor vehicle accidents. So what the program does, it begins the board preparation starting with the very first semester. And actually, because of the textbooks, the classroom content, the presentations, the labs, the clinical rotations, it's all embedded with evidence-based practice with the clinical practice guidelines. They're all aligned with the national board exams that's provided by the NBRC. So during the intermediate and ending with the advanced courses, the professors begin to bridge all that foundational knowledge, and they add new knowledge to that, and they put it together in a bigger picture, and then basically, how it's all connected. So as a whole, the curriculum is aligned with the national board exams, as the professors ensure several components of the exams matrix are taught within their respective courses in a progressive fashion.
I've got about 30 seconds left, but what do you personally enjoy the most about working with these students?
Well, first, the student made that choice to become part of the ACC Respiratory program. So as a graduate of this very same program, it's been an honor to be their professor, sharing their educational journey. As a student goes through the program, I've witnessed their transformation. They've changed from like modeling to recalling knowledge to now processing multiple data from the patient, using their critical thinking knowledge, confidence level. They begin to realize that once, when they came to this program, they each had an initial goal of why they wanted to come here. And then what happens is there's that transformation. They begin to realize that there's something bigger that they're becoming a part of.
Right.
That it's now, that they're a productive member of the healthcare team, that their actions actually have a positive impact upon society.
James Campbell with the Respiratory Therapy Program over at Coleman College. We appreciate you joining us. We're going to have all the links, folks, to look into this program in our social media post after the show. Thanks, James.
Thank you, Todd.
All right, we're going to take a short break. When we come back, we'll meet one of our recent graduates from the program. We'll be back on the topic in 60 seconds.
Sometimes what you need just shows up. Houston Community College has your back, whether you're knocking out some basics or upping your game for a better job. Enroll today for spring classes and frame your future with HCC.
When I was your age, I was just like you, fascinated by stars. But now I get to search for life in the universe. And who knows, maybe life is looking for us too.
So we're like aliens to them?
Yeah, Does anyone want to be a scientist now?
I do.
Awesome. We need more girls in STEM.
Maybe we can find aliens.
Things could be stranger, but I don't know how. I'm going through changes, through all of the strangeness. I'm going through changes now.
Welcome back to The Topic. I'm Todd Duplantis, and we're live every Tuesday afternoon at 1 p.m. on Facebook and YouTube. Subscribe to our YouTube channel and follow us in social media as Houston Community College District. All of our shows are available as audio podcasts. You can download them for free at hccs.edu/podcast. We're talking about Coleman College's award-winning respiratory therapy program. We've got a recent graduate joining us right now, Giovanna Sosa, and you were recently attended your pinning ceremony in July. Welcome and congratulations.
Hi, Todd. Thank you so much.
First, I'll ask you, how did you hear about this program?
I'm not gonna lie, I initially was looking at nursing, and I guess because it was more of a higher demand at the time, because when I found out about respiratory was during COVID, I started looking more into it on the website, the Coleman website, and was intrigued. So I got into the prerequisite course, which is the Respiratory 101, and pretty much fell in love with it from there.
What's the program been like for you, and was it challenging?
It is a challenge just because you're giving up a lot. It's not just giving up a social life. It's pretty much giving up a lot of, as far as like anything outside, like no TV, not that much family time. But the way I saw it, it's worth it, because it's something hard. It's something that, you put a lot of effort, time, and energy in, that pushed you to motivate you to want to get to the end.
So it sounds like it was pretty intense. I mean, if you're giving up family time, all this, you've got a lot of classes, clinicals, all that. It kept you pretty busy for those 2 years, you're saying?
Yes, it was pretty much a full-time job by itself, with some overtime and no extra pay.
Right. How would you describe the faculty in preparing? We were talking earlier about the board exams. How hard were they? And then did you feel like you aced them when you went through them?
So I actually take mine tomorrow.
Okay. I don't want to jinx you, then. Good luck.
Thanks. No, I would say they drill us because they want us to succeed the first time, rather than having to take it and be more nervous taking it the second time. So I would say they prepare us pretty well to where it's like you can just read the question and analyze it and not even look at the answer choices and just already know what the answer is. I understand in order to help pay for your college, you worked with Capital Idea Houston. How did they help you out? So it wasn't just financially. Let's say if I had any stressful moments at school, I know they would give us tips as far as how to study differently, how to look at different views as far as instead of just reading out of a book, what other study methods can we look at? As far as if I had any stressful situations outside of school, not related to, grades, let's say if I was going through something, I could talk to them, and it would be somewhat of a therapy as well.
What were your clinicals like? Where did you get a chance to work? Are you still working in any of those locations?
So clinicals, we went to Memorial Hermann, Texas Children's, where else did I go? Bentop. I am working still as a student with Memorial Hermann at Southwest. I'll soon be leaving them to go to Texas Children's.
And where is that Texas Children's, where you're hoping to land professionally once you pass your boards?
Yes, hopefully with pediatrics. I do eventually want to move up to doing ECMO, or maybe join the kangaroo team. We
talked about this earlier in the show, but a lot of people learned of this therapist position because of the onset of COVID. Have you had a chance to work with people who have either long-term COVID from the symptoms or recovering from COVID? Have any of those been patients of yours?
I have had a few patients to where they needed a lung transplant.
Oh, wow.
And still continue to have a few COVID effects to where they need pulmonary rehab and long-time oxygen therapy.
And it's kind of a weird situation we're in right now, because I imagine in the medical field, we're still learning the effects of what's happened after many of us catching COVID. How does that play into the way you work with patients? Because it seems like there's still a lot to learn and we don't know all of it yet.
That's true. I mean, I would say anything in the medical field is a learning progress, because we can't treat one patient the way we would treat the other. They may have similar symptoms and side effects, but at the end of the day, every patient is different. Every situation is still different. So it's still a learning progress regardless what we do. Of course, it's a trial and error, but hopefully like less error, because
right.
It's someone's livelihood, and we definitely want to help them live for as long as possible.
What's been the most rewarding thing for you in this journey so far?
I would say the fact that I learned more about respiratory therapy. I initially thought it was just providing oxygen to a patient and that's it, but there's so much more, so many different connections, so many different areas that you can get into. It's not just as far as, hey, like, let me help you breathe better. It's more as like, hey, let me help you improve your livelihood. Let me help you, different ways, different aspects as far as how I can help you breathe better. Just do anything respiratory, not just say you're stuck with the situation. Like, just like whenever someone breaks their leg, they go to physical therapy, they find alternate ways of working out. It's the same thing with respiratory.
Well, I know we've only got about 30 seconds left. If somebody's thinking of going into this program, what would be your advice to them?
It's definitely worth it. I mean, I know I've said there's a lot of, giving up, but at the end of the day, it's worth it, because I know the little of time that I've worked with kids, adults, the little therapy that I've given them, I could just see it in their face, like the relief, where it's so rewarding than just having to look for that thank you, just with their facial expression says everything.
Giovanna Sosa, we appreciate you being here this afternoon. Good luck with the board exams tomorrow. Teddy's saying that 2 of your cohorts already passed, so you're in good company. You got this.
Thanks.
Thank you for being here this afternoon. Thank all of you for joining us on the topic. If you're interested more about the respiratory therapist program, we'll have all the links in our social media post after the show. I'm Todd Duplantis, and we'll see you again next week.